This medication makes you eliminate sugar through urine. Want to know what it is, how it works, its risks and benefits, and how much it can lower blood sugar? Does this medication cause weight loss? Does it help the heart and kidneys? How to spot a potentially serious complication from this drug? So let's talk all about the SGLT2 inhibitor class. Have you heard of this acronym before? These drugs have become increasingly popular. That's what today's video is all about. I'll mention drug names and some brand names too. I've got some pictures here to show you. I don't sell products or partner with pharma, but I'll mention several names since we're discussing this drug class. Not recommending any, okay? This medication can be dangerous, as you'll see in this video. So, don't use it without talking to your doctor first. It could have serious consequences. Okay, what are these medications called and how do they work? This class is called SGLT2 inhibitors. First, they prevent sugar reabsorption in the kidneys. Normally, our kidneys take sugar and send it back to the blood instead of urinating it out. This drug blocks that reabsorption, so you pee out more glucose and sugar. Does that make sense? And what are these medications? I've brought several. The active ingredient ends in flozin, like empagliflozin. Here's a photo of the brand name. There's dapagliflozin, canagliflozin, tough to pronounce, and combos with metformin, like these two. Do you recognize any of these names? Probably, right? There are other combinations too, and I've brought one here. Linagliptin, a DPP4 inhibitor. That's its brand name. These brand names slightly differ between countries, often just by a letter or two. Take Farxiga, for instance. It's Forxiga in some places. In a video, I said Farxiga with an A. Many criticized me, saying I was wrong, but actually I wasn't. Yeah, it has various names. Depending on the country, it's spelled with an A or an O. Got it? That's why I've mentioned both names here. These meds have gained popularity as studies show heart benefits. They may improve heart function, protect it, and even lower heart failure hospitalization risk. Did you know that? So for certain cases, it could be a good option. Studies show ISGLT2 drugs can protect kidneys and slow kidney disease progression. Isn't that fascinating? Several mechanisms explain these effects. First, it improves blood sugar control. It also eliminates sugar via urine, acting as a diuretic to remove excess fluids. This can benefit many, especially those with high blood pressure. It's quite fascinating. How it helps. It can aid in controlling blood pressure. While not an antihypertensive, it can help when combined with certain medications for blood pressure and heart health. This is crucial for diabetics as heart attacks and strokes are major concerns. The medication has proven safe for these patients. However, I want to emphasize that caution is necessary. Why? As we've seen, this drug class prevents sugar reabsorption, so you can imagine that urine contains more glucose, right? Correct. This can lead to an increase in urinary tract infections. So, if you're taking this medication, be alert for urinary infection symptoms, burning or pain when peeing, frequent urination, feeling like you didn't empty your bladder, or sensation of fullness even after going. These could indicate a urinary tract infection. It's crucial to stay vigilant and talk to your doctor promptly if you notice these symptoms. This is one precaution to keep in mind. There are others. Why? This drug class can increase the risk of a condition called euglycemic diabetic ketoacidosis. It's a complex term, but it's a potentially fatal complication that can occur even with normal blood sugar levels. Always inform healthcare providers you're on this medication, so they're aware. Okay? For type 1 diabetics, it's also contraindicated. This drug is for type 2 diabetes due to its action mechanism. So in type 1 diabetes, it can be very dangerous, okay? It shouldn't be used. It's a contraindication. Also, patients over 85 years old. Why? You've seen it can have a diuretic effect. In this group, it may increase fall risk due to low blood pressure. So extra caution is needed. Patients with kidney problems. Now, you might be confused. I said it can protect kidneys. But for those with issues, especially if function is below 30%, it's contraindicated because it can greatly increase complication risks. If you're on dialysis or hemodialysis, this drug is also contraindicated. So an assessment is necessary. That's why I said, don't just take meds because you saw a video. This video is for guidance only. There are other risks with this medication too. To be fair, I must mention both sides, including hypoglycemia risk. When used alone, this drug rarely causes hypoglycemia, even though it blocks glucose reabsorption. Studies show it only does this when blood sugar is high. At normal levels, its effect isn't strong, which is actually a beneficial feature. It becomes more active when blood sugar rises. At normal levels, it doesn't really cause hypoglycemia or significantly lower blood sugar. But using it with insulin or other hypoglycemia-causing drugs like gliclazide or glimepiride can increase the risk of low blood sugar. Generally, when combined with metformin, you've seen various combos, they usually don't cause low blood sugar. But pay attention to low blood sugar signs: shaking, racing heart, cold sweats, and confusion. If this happens, check your glucose, note it down, and talk to your doctor. You might need to adjust your treatment. Often patients have these low blood sugar symptoms, but when they check, their levels are normal. Why might this happen? Have you ever wondered? I know many diabetics have this question. Let me explain why. Some people are used to having high blood sugar levels. When treatment normalizes it, the body might react and show these symptoms. Interesting, isn't it? You need to do a test to confirm if it's really hypoglycemia, if your levels are low, or if it's just a feeling, okay? Sometimes even with normal blood sugar levels, your body can be so used to high glucose that you feel these symptoms. Got it? That's why it's better to gradually lower blood sugar levels instead of starting multiple medications at once. Because patients can have many symptoms, and feeling hypoglycemic with normal values often hinders treatment. Why? Patients who felt fine before might start feeling sick once treatment begins. Has this happened to you? Share in the comments. I always enjoy reading them. This is a common issue in diabetes treatment. It can happen, but don't worry, it's just your body adjusting. Make sure to get evaluated. Many people ask if this medication should be taken with meals or not. The answer is that it doesn't have to be. You can take it at the time your doctor recommends or when it's most convenient for you. It doesn't need to be before or after meals. Studies show it helps both fasting and post-meal glucose levels, which is very beneficial. Now, does it cause weight loss or not? What do the scientific studies say? Due to its diuretic effect, studies show patients may lose up to 2 kilos, 4.4 pounds. This weight loss effect is interesting and may explain many of the drug's benefits. I also want you to pay attention to storage. It should be stored between 15 and 30 degrees Celsius. Some people live in very hot climates, others in cold ones. So proper storage of this medication is very important. How much can this drug lower blood sugar levels? We use a parameter called glycated hemoglobin. Studies show this drug can reduce glycated hemoglobin by 1.5 to 2 points, a significant change. It's considered a potent treatment for type 2 diabetes. A common reason patients see endocrinologists is when they're on this drug and take a urine test. The urine test shows glucose, often 2 or 3 plus signs of glucose in the urine. This is actually an effect of the medication, as you've seen. Many patients get scared thinking something's wrong, but it's just a side effect. So if you take a urine test, it'll show glucose in your urine. For diabetics, this happens when using this type 2 diabetes medication. Any questions about this drug? Want me to discuss another one? Did you enjoy this video? On a scale of 0 to 10, how would you rate it? If it's a 10, I'll make more like this. Also, where in the world are you watching from? I'm speaking from Porto Alegre. Now, here's a video suggestion for you. It's about high triglycerides. Did you know high blood sugar often links to high triglycerides, a metabolic issue? Learn the best foods and which to avoid. The advice is similar to recommendations for diabetics. Worth watching if you have high triglycerides or diabetes, or for general health. Click here to watch the triglycerides video. Take care. See you next time.